Should we jump in?
Yes, it is Monday, February 2nd, and suppose I should say it's 3:04 p.m., just given the rate at which news has been happening today.
It's 3:04
I'm
your time, Martin.
yes, on the East Coast. It's
Specify.
2:04 in HTN local time, and by the time we get this out, there'll probably be many more pieces of news. But in the meantime, Kevin, why don't you kick us off and talk a little bit about the advanced rate note musings you had last week in the newsletter?
Yeah, so I like the way you framed it up actually in your newsletter. One of our community members shared his perspective that this is probably the biggest news we might hear this year, and I find it hard to disagree with, right? The ripple effects, as I wrote about it, feel pretty meaningful potentially. I'm sure everybody saw the high level news, right? The effective average change for payers is 0.09%. CMS releases their little table where they walk through the effective growth rate and some changes to that effective average change. So, like one of the, I think, learnings for me in this is you're going through the numbers, seeing them on LinkedIn, whatnot. A lot of folks will talk about the effective growth rate number. That's one number, and that's the starting point. And then there is the effective average change number at the bottom of the table, which is the effective growth rate and all of the other things that CMS is doing. The effective average change is the important one for payers because that is ultimately what they're going to get paid differently this year, right? So that's what comes in at essentially a 0% increase. Um, and the market was not thrilled by that news. The publicly traded insurers are down $100 billion on the news overnight, which is obviously a massive decline in market cap, over 10% for all of them. Humana actually continued falling during the week and ended up down 26%, which is bonkers off this news, but indicative of the importance of it. Not only, though, was it the big publicly traded companies, it was also the Alliance of Community Health Plans. I had to make sure I got that right, which is there's my thumbs up. Um, the Alliance of Community Health Plan represents provider-sponsored groups in their local markets, right? So these are regional health plans. They are not the big bad risk adjustment vertically integrated entities, and they're out saying it's disappointing and wholly unrealistic. And importantly, I think it's worth noting that they say that despite being supportive of the changes that CMS is suggesting making to risk adjustment, which gets into one of the more interesting nuances in all of this. So Chris Klomp did an interview on Tuesday. Kudos to him for doing an interview the day after this news came out. And he talked about it with the Paragon Health Institute. And one of the things that Klomp it was interesting to me to hear how he framed his commentary around this topic, right? He came out and he said a couple of times. Once he said, "Make no mistake, let me not mince words in the least. We are massively in support of Medicare Advantage. It's a critical component of the future of Medicare." Very strong support for the program, right? Like trying to make it clear in no ambiguous terms that they support the program. At the same time, they took $100 billion of market cap out overnight. What he described, though, as kind of the change they were trying to do at one point in that conversation was this risk adjustment change. Level the playing field, make it so that all players have equal footing from a risk adjustment perspective, because all that mechanism is conceptually supposed to do is if you get a sicker member, you get paid a little more. It should not be a strategic advantage. And I don't know about you, but I don't think that's that out there of a statement. I think everybody in the industry probably would agree with that. And that I actually think is the like in that Alliance of Community Health Plans commentary, there's no pushback at this point on this idea of risk adjustment. It almost feels like okay, let's just get this show on the road. Like do what you're gonna do and let's keep things going. The challenge is that while Klomp made the and CMS made the changes to risk adjustment, they essentially said what he said on the interview was we changed risk adjustment and the rest is just actuarial math. It is what it is. And that I think is the underlying issue here because if it were just actuarial math and it was that clear, I don't think you'd see the industry responding the way they are. Like clearly there's a disconnect in that actuarial math and what the effective underlying growth rate is. Like that's that number, right? We heard about this and we talked about it on it was Humana's Q3 earnings call. There was an analyst speculating that the effective growth rate, the start of the table, could be 9%. And it turns out that if you start 5% higher or 5% lower, that has a huge impact on the overall industry. And that's a meaningful change. And so it's going to be really interesting to watch how that effective growth rate number comes in over time. We've been talking about it in the community. There was just a comment being like, how much can that actually change? Like, it's actuarial math. The actuaries follow their process. Now that they've put something out there publicly, how are they going to justify changing that? So we put a poll in the newsletter on Sunday asking how much people think the rates are going to go up. Typically, historically, the number goes up around 1% between the advance notice and the final notice. There are a couple years where it goes up a little bit more than that. There's a couple years where it goes up a little bit less than that, but like 1% is kind of right down the middle. Um, Most people who responded to our survey, we had 100 plus respond at this point, are on that high end of the spectrum, right? Um, I actually think I'm gonna come in on the low end of that spectrum of my guess of where it's gonna be. Like, I don't think they're gonna hit 1% because I do think at this point CMS has indicated what they think of this. It's risk adjustment and it's actuarial math. And tough love, but that's the actuarial math. And I think this is going to have huge ramifications for the industry. It's going to change the way startups approach the space, investors approach the space, big companies approach the space, and I think it's a new era for Medicare Advantage if that is in fact what is happening. Now, there's the other side of the equation where maybe it's a higher number they come in at, and they say no, like we're backing off this, and it's all part of a negotiation. But I don't know. I think this is a really, really big moment for the industry to keep an eye on. What's your reaction to it? You talked in your newsletter about Humana alignment, some of the differences there, and behaviors you're trying to incentivize. Like, how do you process it all?
Yeah, so a couple of things. One thing I really, CMS every year publishes the national health expenditures, their forecasts for national health expenditures. It's interesting that the actuarial math for, that CMS, the Office of the Actuary, put is
Mhm.
so different from the national health expenditure estimate, which is done by a different group of people in CMS. But looking at, this isn't the most recent year, but they have from 26 to 27 that Medicare is going to be in the 6.5 to 6% range. And so
Mhm.
that I like how you calculate that effective growth rate is, I mean, it's not just math. There's a lot of assumptions built in there. I think two things.
For sure.
One is one thing that you could say, and a thing that I think, ACHP would really like is if the playing field was leveled for smaller plans. And you can imagine a more competitive Medicare Advantage market. And there's some really good health affairs literature about what happens when markets are more competitive, and it's great for beneficiaries and it's better for the government. And we would like a market where there is more players in Medicare Advantage. And fixing risk adjustment, I think rightfully so, has been identified as a lever to make it more competitive advantage. One of the things that happens when you just take a Hoover and suck out a bunch of money is that the small plans who are undiversified, have less capital, less resources, less access to capital, they go out of business.
Mhm.
And so I don't know that this is going to achieve that goal, right? If the growth rate is basically non-existent, a bunch of regional, you and I talk about the Healthscape advisors chart, but a bunch of regional plans are not doing well. And this is not going to convince creditors to lend them money. It's not going to convince hospitals to say, oh, yeah, we should invest in our health plan because MA
Mhm.
is not looking good for 2027. So I don't know if it achieves that goal. I do think from a competitive perspective, it is interesting. And I think one way to kind of bucket the big, and I say, big being the publicly traded or private market MA plans, is that I do think that this is much more beneficial to Alignment, Clover, Devoted than it is for, I'm not going to like pick on Humana, but for the business as usual MA plans, right? The
Mhm.
MA plans
Sure.
who've largely engineered their business around risk adjustment, and they just have a lot more room to fall. as the alignment health folks like to say. So I think it's going to be interesting from a competitive strategy perspective for the alignments and the devoteds. I'm kind of excited to see how that works. I do think though at a macro level, we're looking at it probably if these rates hold a extinction level event for a lot of regional nonprofits.
For sure. I mean, it's on the heels of V28 taking the industry down for 3 straight years. You've then got this, which adds it on for a fourth year in an environment where everybody seemed to be predicting, it's Trump administration supportive of Medicare Advantage. It's going to be reverting back to a better period for MA, and that's just not there. One of the other last thought on this topic, things that I will be interesting to track. So the risk adjustment change ties risk adjustment scores to visits with a doctor, right? And on the call, Chris Klomp walked through a very rational take as to why you want to do that. Ultimately, you want to incentivize people to get care from a doctor. That helps them get healthier. That is a good thing. I cannot help but wonder if I am a rational actor reading these rules and thinking about risk adjustment scores for the industry. I think that incentivizes me as a provider if I get any sort of bonus, incentive, etc., for my risk adjustment scores to get people back into the doctor more. So while you are lowering, I suppose not lowering, you are not increasing rates because you are saying that the costs are not increasing that much, and this is an actuarial math game. You are actually potentially inducing more consumption of healthcare services and increasing medical trend more than would otherwise be the case in historical data. So that is going to be a fascinating thing that I will be interested in keeping an eye on in the market is, do you have this sort of double whammy effect of you're not only not keeping up with the trend that everybody's seeing in the market, but you are also then inducing more trend because you're saying, hey, like, go back to the doctor visit.
Yeah, and CMS thinks you're right. Right. They say when considering estimated risk score trend in MA driven by coding practices and population changes, the expected average change in payments will be 254 basis points. That's inclusive of the 9 basis points that they're spotting them with
Mm,
the effective growth rate. That's more than it has been in past years. I think it's like 50 basis points more than it was last year for what they expected. And yeah, I think you're right. And this is partially why I think, Clover and the Clover Assistant is like sort of built for this. But I also think that the we've seen general increasing levels of coding intensity.
mhm,
Whether that is AI driven or not is an open question. I think it's like largely unknowable whether it's real or a,
for sure.
but the AI is going to be really good at helping them hit or meet or exceed that 2.54. So I responded to the poll as I always do, and I think that where it lands is going to be mid single digits, and that's going to be based on that number being. So this is not directly to your question. This is like where it
Mhm.
actually lands, but I think it is going to land in mid single digits because I think the MA plans are good at what they do. And, I assume we get 1 percentage point from a sort of more favorable no,
Yeah.
rate notice, and then the rest of it's just going to be all of the folks at the plans getting hard to work, and especially the big guys. So,
So you've got it at like what, the expected average change in the final notice you think will be what, two and a half ish?
yep,
Yeah. Yeah, and that seems like a reasonable bet for me. I think for the sake of being provocative, I will go, it's going to be sub 1%. I'll go 0.75%.
yep,
It's going to be interesting to keep an eye on. We find out the answer to this in what, like early April, right?
yeah.
April's,
Comment period is open, so if you have strong feelings on this, you can go to the Federal Register and leave your comments.
and they read them all,
They
apparently.
do. They really do. Some poor analysts. So if you are up for it, yeah, please go. Please go to the Federal Register and comment. When we were chatting with Andy, he encouraged people to reach out. So
For sure.
he knows. Okay, there was a lot of M&A activity in startup land this last week.
Yes.
What happened?
I on any other week of the newsletter, I would love to have talked more about this. we saw three pretty meaningful deals go through, right? Sword Health acquired Kaya for 285 million bucks. They also shared they're raising $500 million to go out and do more acquisitions. Spring Health acquired Alma in the mental health space, and Premise Health acquired Crossover in the primary care on-site near site clinic space for employers. Those are all three pretty sizable transactions to go through. And to me, it's indicative of a broader trend we're seeing, and I think interesting in two primary ways. One is we're finally at the end of the last era of venture fueled excitement in digital health, right? The runways are running out, companies are finding their landing spots, and we're seeing how this is all playing out, which I think ultimately is a healthy thing for the space to get through, right? Like it's been a long tail for these companies trying to figure out how they extend, where they land, what the exit potential is. And I don't know how good or bad these exits are, but they are exits. We are figuring out how these companies come together. And I think it's an interesting, the second part of this is it seems like a really interesting time to be building in the commercial market in particular, as we see with those types of companies from mental health to MSK to primary care. Given the cost trends that employers are facing, I talked with Owen Tripp, who runs Included Health. They just announced a new alternative plan design last week, too, which is also really interesting news. And you can go listen to that interview in the feed if you want more on that. But one of the points he made was the world for employers is going to get a lot more complicated over the coming years as they try to manage the costs of these populations in various different ways. And brokers are going to play a really important role in helping navigate all of those dynamics. And you can almost see it playing out in these sorts of acquisitions of companies are trying to reach scale to get to a point where they can be durable long-term partner to employers in this way. And I think it's a really interesting market in that regard. So I am curious to see kind of how the deck gets shuffled over the course of 2026. It seems like I would guess we'll see a lot more M&A throughout the year. Sword has certainly indicated they're going to be very active. I think we're going to see a lot of these kind of mid-tier companies that haven't quite reached scale have a cap table that is getting a little long in the tooth, have a founding team that has been there for a while now. And I mean, these are long, arduous journeys for founding teams. Wouldn't be surprised to hear that some of them are getting burnt out towards the end of that journey and looking for a home. Um, Makes sense that we're going to see the roll up of these markets into more scaled offerings that I actually think the public markets have taken a big lump in employer health in recent years, right? It hasn't been a great strategy. There's a lot of revenue concentration risk that creates issues for them as public companies. I could see a window open up for these companies to do really well. So I'm excited to see how that market plays out.
Yeah, absolutely. I think it's the conversation with Owen is actually a really nice sort of addendum to these three because it fits
Yeah,
really nicely in what he was talking about with brokers playing this new role where they're helping medium to medium plus sized enterprises manage all of this stuff.
for sure. To me, there is like a thing that I am really interested to keep an eye on in the space that I don't think enough people are talking about. I talked about this a little bit in the newsletter on Sunday about how I think we are at the tipping point where we're seeing a two-tier healthcare system emerge in this country, right? There's going to be a government um, pool of coverage that somehow will work itself out over the coming years, and then there's going to be a pool of coverage for people who can afford it. I think in a world where AI automates away a lot of jobs, where big companies still need really high-end talent to think about how to implement AI most effectively, and are grappling with healthcare costs and how to manage that effectively, this is going to be one of the most important things for employers to figure out and offer high quality healthcare benefits to attract employees to come work for them so that you get access to their healthcare benefits. I think that is going to be a huge selling point for large employers going forward. I think it is a reason for employers to lean in more. I think everybody's worried about them pulling back with the state of the world, but it actually seems to me like the exact opposite is going to happen. And if you can stitch together that stuff well, you're in a really good spot. So, anyways, I'm going to get off that, but that is one of my kind of things I'm interested to see over the long term.
All of this is happening in the context of Q4 and year end earnings season. So you were on point for Elevance and United Health Group. What what are the highlights from those two calls?
It's It's kind of the opposite of the employer market seems like there's a lot of energy right now and a lot of interest in that kind of cash pay employer alternative plan design space. It is a really hard market for traditional insurers, as we talked about with advance notice, right? And that came through both in United and Elevance. United, it's in process of turning the ship around. 2026 is going to be a key critical year in that. The insurance business repriced the book. They're going to see progress towards returning to their target operating margins. Not going to be there in all lines of business, but they shed a huge amount of MA lives in order to focus on profitability, which is kind of indicative of where they're at the moment. Optum is in the middle of its own turnaround. Optum Health is being targeted towards kind of its core vision, mission, set of assets. I thought Krista provided some really good context on some of the markets that they are in that are performing. The Texas market that she referenced, I thought was really interesting and helpful to understand. So their mid turnaround, working on it. Elevance is also turning around the business, right? Their stock was actually up 7% in the back half of the week on saying they were going to have declining EPS targets for 2026, and they are lowering their long-term target margin as a business. Like the fact that your stock goes up 7% after you share that news with the market, I think is indicative of where these insurers are at the moment. It is tough sledding. There's a lot of work to be done. I think there is the potential for a brighter future ahead for them, but 2026 is just going to be a really hard year across all the government products. Commercial business is interesting to keep an eye on here too. Elevance made the point on their earnings call that I thought was fascinating. They talked about this second blue bid process, which is an artifact of the antitrust lawsuit from Blues Plans. But as I understand it, large employers can basically put their local bit blue up for a bid against any national blue. And perhaps not surprisingly, Elevance is cleaning up in this process. So they talked about there being 11 bids for 2026. They won 9 of them. It makes sense to me that they do very well there, right? So I thought that was interesting to hear from a momentum perspective, and where they're seeing momentum in the commercial markets. So Martin, HCA was the other big earnings call from the week. They also announced on Tuesday, and it seemed like they pretty different overall tone sentiment than insurance market space at the moment, huh?
Vibes could not have been more different. So they beat Wall Street analysts' expectations for Q4 earnings per shares by almost 9%. It was their 19th consecutive quarter of volume growth, and revenue per equivalent admission was up 3.6% year over year. Yeah, they at one point were up, I think, like 10%. Gave most of those gains back throughout the course of the week, and landed around 3%. But wow, just an impressive quarter. And the HCA story continues to be one of like they're just executing their playbook very, very well. And I think that one of the interesting things about that is, they're like all hospitals looking at some pretty significant policy headwinds going into 2026. They are, saying it's going to come in somewhere between 600 to 900 million dollars, and that's ACA and Medicaid driven, changes to Medicaid financing. And they have this resiliency program that they're talking about. And they're like, well, the resiliency program is going to be worth 400 million to offset some of that 600 to 900 million. And you're like, okay, well, that sounds great. What's the resiliency program? And they talk about revenue integrity, variable and fixed cost efficiency, and capacity management. And if, you know, I have no doubt that an operator like HCA is going to be very disciplined on their variable and fixed cost efficiencies and their capacity management. But when you're known as the disciplined operator, you have to wonder like how much variable and fixed cost efficiency you can squeeze. And so I think what I suspect, and I'd be curious for your reaction to this, is that $400 million, a lot of that's revenue integrity. I don't know. What do you think?
I Yeah. I mean, everything you just walked through, I think makes sense. I don't know that I have a ton more
It's
that I would add on top of that. I like it. Yeah, if you think about the levers that you can pull and where HCA already is in the market, to your point, I, it wouldn't shock me to hear that.
Yeah. So I think, a question that you and I have been kicking back and forth is like, where are we in the, sort of search for Nash equilibrium between the payers and the hospitals when it comes to the AI coding wars? And I think a big part of, a big early indicator of that is progress towards that $400 million um, in the resiliency program. Like I would imagine analysts are going to follow up on progress for that. And I think
Mhm.
that that's going to be a bellwether for us on the where we are in the bot wars.
For sure. Given HCA's execution over the past few years, I would not be surprised at all if you and I were running HCA and we were coming up with that resiliency number. You've got a number that you are very comfortable with hitting internally, and then you've got stretch on top of that, and you are managing teams across all of that. I gotta imagine they're looking at that 400 million as a slam dunk. And there is significant opportunity for outperforming that as well as these headwinds come to fruition. And that'll be really interesting to watch.
Yeah.
I'm curious, Martin. One of the things that stuck out to me about the HCA call was the last analyst question of the call asking about 20% margins and if HCA could sustain them over time. And I thought HCA answered it well. Like they demurred from actually answering the question of what long-term margins would be, but they talked about the strength of the operating model and so on and so forth. And it's fascinating to me to juxtapose that with the conversations we were just having about insurers not being able, like lowering long-term target margins in the mid-single digits. Those are just two fundamentally different worlds. And we had an interesting conversation in Slack this morning about data from Indiana and the hospital market about how some hospitals in Indiana in 2024 had 30% plus operating margins, while some are negative. And I'd be curious, how do you process that? Like, what is happening in the hospital market that you could be talking about HCA generating 20% margins in the long term, and you've got so many hospitals being like, we're barely staying afloat. Like, what gives?
Yeah, I think that we're increasingly entering, you talked about a two-tiered system with a government system and a cash pay commercial system. It really feels like with hospitals, it's the haves and the have-nots. And
Mhm.
HCA is 100% one of the haves. If you're a hospital system, there's a few different things you can do for revenue growth on the price side. And you can negotiate higher rates with payers, which is going to be like getting blood from a stone for the next 3 years at the very least. You can improve your payer mix. It's going to be tough given Medicaid and ACA being what they are. Or you can secure new supplemental payments. And that's going to be hard because the One Big Beautiful Bill Act is sunsetting them. And so you have a window where you can continue to collect them, but it's going to start going down. And so what do you do in that situation? Well, HCA is going to start using their very healthy balance sheet to do more M&A and de novo builds, and they're focused on outpatient. And the story that they tell is that outpatient is really a story about the top of funnel for them. You get someone to
Mhm.
come into one of their ambulatory or outpatient settings, and then they're part of the HCA family, the HCA universe, and they come in. That's true. And that's been what every hospital system has talked about as they're acquiring ambulatory and specialty plans or assets. The other thing I would say though is the other thing that HCA can do is if you're a hospital, you can buy a urgent care, turn it into a freestanding emergency room, and charge a higher rate and facility fee because you're a hospital. And regulators and payers are working really hard to erode that capability. And so site neutrality is the at the federal level the regulatory thing. States hate this. State Medicaid agencies in particular hate freestanding emergency rooms. But I think that, it's like, is 20% possible? I think 20% is possible if we don't see much movement on site neutrality because, yeah, that's
Yep.
like a great strategy. If you can take a line of business and acquire it, turn it into top of funnel and just raise the prices, what more could you want?
Yep. Given what we have seen from the administration thus far, I find it really hard to fathom that site neutrality is not coming in a more significant way coming down the pipe. Like just the general populist narratives, not liking complexity, disliking big. The I actually buy the justification I've heard. I think it was from HCA, maybe it was from Tenet, talking about how they have more infrastructure. They treat sicker patients than outpatient only places do, so they should be able to charge higher prices because it costs more for them to operate all of the infrastructure. If you don't want them to operate that infrastructure and just go outpatient, they will happily do that. It's just they're not going to operate at the same high level that they are today, which is an interesting kind of downstream consequence of site neutral. But like just given the kind of broader societal conversation we're having today, I don't see that sort of nuanced conversation from HCA winning out in DC when eventually and inevitably the administration turns its eye from payers, pharma to, oh, HCA is talking about 20% margins. You've got hospitals in Indiana with 30% margins. We're going to talk to you guys now. Come to the principal's office, you know?
Kevin, I want you to pretend that you are overseeing a state's rural health transformation program
Okay.
dollars. And it's you happen to live in a state where HCA is a big operator. And HCA is like, you have HCA and then you have your, regional nonprofit quasi monopoly, right? Who's like going and doing venture capital investing on the side and getting lots of donations from your local billionaires. And you're trying to figure out, okay, it is not profitable to run rural healthcare. Like it's just not profitable to do rural healthcare. Are you gonna try and play matchmaker and say like, okay, HCA will give you some money and will help you kind of do the use these locations as satellites and do some stuff in a row because you know that they're at least very highly efficient and good stewards of capital and relatively transparent. Or do you give it to your sort of like, your local regional university of whatever? Um, I don't know. Like I'm curious what if you think the money is going to end up back in a health system, which I think it will,
Yeah.
what horse do you bet on?
So I actually think I would do a barbell. I would do HCA on the one end of the spectrum, and I would get like said differently. And the administration is a big fan of competition, right? Free markets, competition, which makes sense to me. What I hear, it's a true in insurance markets and provider markets. HCA, because of its scale, is actually more efficient, and their margins demonstrate that, right? There's always the question of do the more regional players as they acquire each other, does that actually generate efficiency, scale gains, et cetera? And it seems like the data, as I understand it, suggests the opposite. Costs go up. They're not more efficient. But HCA actually has proven to be a really efficient health system. I would give them the money to manage because they're doing it more efficiently. So I would give them first and foremost the dollars to help them figure out, okay. And then as the regulator, you put some guidelines around, hey, HCA, here's what I want to see in return for these dollars. And then I also think you go very grassroots, small doc, and you say, hey, we're going to support if a PCP wants to go work in rural town, we're going to pay them better to go do that, right? And you come at it from those two ends of the spectrum. The HCA end is going to need more dollars and support. I think there is still merit to that small end of the spectrum, particularly in this AI enabled world where you can make life easier for them in that way. You leave out the middle in that spectrum though, and you go barbell. That's my personal take on things.
I like it. I like it. Well, Kevin, I got a message from you this morning saying that there was a surprise tenant news conference, and I immediately logged on. So Common Spirit is paying Tenet $1.9 billion to exit their contract
Yeah.
for Conifer Health Solutions, which was a surprise to me. I know that the history of this is basically Tenet had Conifer Health Solutions. They eventually they brought on Common Spirit. It was a joint venture. They had thought about spinning it out in the early 2020s and ended up keeping it in house. And then this morning, surprise, their Common Spirit has decided to bring their rev cycle in house. What
Yep.
was
It
your
is the
reaction?
I I was a little confused, to be honest. I We don't hear a lot about insourcing of RCM in today's market, right? It was interesting to go at JP Morgan a few weeks ago, Ensemble, which similar RCM play that did spin out of Bond Secures, and has done very well for them as an investment. In so doing, talked a lot about how, 2010, early 2010s health systems all wanted to have RCM internally. They viewed it as a key competency. They wanted to have it in-house. And then as the labor market got harder, and as things got more and more complex, they started saying to themselves, we could outsource this to a third party partner who can do it better than us. We don't have to worry about recruiting the talent in to come do this. And so it's made more and more sense for health systems to outsource it to a third party. Generally speaking, that makes sense to me, right? If I'm running back to our point on the efficiency of these regional health systems, it seems more efficient to run it via scaled third party platform partner. So it was fascinating to hear Common Spirit saying, no, we actually are going to re-insource this again. We don't need this partner. And it took me a bit to walk through like why and what might be happening, but where I netted out on it was I actually think this makes a ton of sense for a health system to say, hey, um, whereas we used to be really inefficient at this, we couldn't hire the talent, et cetera. We now have all access to all of these AI tools that we can bring in-house and take advantage of. So whereas we could work with you, third-party partner, but we're paying you a premium to go do that for us, we can now have a small staff of people who manage the end-to-end process for us and pick and choose what point solutions we need to use at various points along the way. But it actually puts us back in control of the rev cycle management process, gives us more visibility end to end, which should improve outcomes for us. And we can pick and choose what solutions we think we need for our local market and our unique set of assets. That actually makes a ton of sense to me, right? I'm like, maybe it'll be interesting to see if more health systems take this approach. I don't know. What was your reaction to it?
I had a similar reaction, which was I buy the idea that AI has made rev cycle less of a unique skill set, something that you can insource
Yep.
in a reasonable way. I think what makes this so confusing is okay, so Common Spirit is paying 1.9 billion to exit the contract.
Yes.
Conifer paid Common Spirit 554 million as, consideration for their 23.8% equity stake. So Tenet is netting $1.36 billion on the deal and owns all of Conifer. That seems like a really, 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 really suspiciously good deal for Tenet, right? I mean, like you are paying me, and I now own the entire thing, and that sort of just raises my antennas a little bit. Like, oh,
Yeah.
is are they is Common Spirit like, man, this business is a dog without us as their largest customer, and we might be first, but this is going to be there's going to be a and an analyst question was like, hey, what how are your relationships with your other customers? And they're like, it's great, we're continuing to sign people. And so I think it'll be interesting to see how it plays out. The
Yeah.
other thing that I thought was kind of fun, financial accounting wasn't my best subject in business school, but uh, at book value, Common Spirit's stake was 885 million, and Conifer is paying Common Spirit 554 million. And so Tenet is booking a positive change because they bought this for less than it was worth.
It's an interesting dynamic. I listening to you talk through that, it would be fascinating to see the financial case that somebody at Common Spirit built to make this seem like a good deal for them. Because I'm sure they've got an internal case where they're like, hey, this adds up for us, right? So them paying out the $2 billion, close to $2 billion to exit the contract, it's fascinating to think about what that means for them internally, that they are seeing that exit and paying $2 billion to get out of this is actually still going to be accretive to them over a reasonable period of time. Like as we talk about health system profit margins, as we talk about the trajectory of them, it seems like a tough period of time to be saying, "Yep, we're going to pay $2 billion to exit this contract offering." No,
And to take a bath on
yeah,
the equity
yeah,
like you're yeah, I okay. I'll
yeah.
be yeah, I'm looking forward with bated breath for Common Spirit's annual report. Or the next time they issue a bond and we get some
Yeah.
disclosures
I
from
actually
them.
think it's just a sign they are that confident and bullish on owning like I think this is a move you do from a position of strength to say, "Hey, we're gonna take this right now. Over the long term, it's a bet we're willing to make playing out really well for us. And we're doing well enough right now." And I'm like, with all these headwinds that everybody's talking about, we think we can just push this under those headwind category. 2026 is still going to be relatively a good year for us, and we're going to net out really well over the long term. To me, that is the overarching like thought bubble in my head here, and I think it says a lot about the position of systems like Common Spirit at the moment.
We only have a few minutes left, and so I want to end on Devoted, an announcement I just saw today, but I think was released on Friday. So they released a press release saying that they had grown to serve over 466,000 members as of January 2026, which is a year-over-year increase of 121%. Holy smokes. In addition to that, they also announced a $366 million Series F in two tranches. A lot of names you'd recognize on there: GV, Morgan Health. Like, I mean, going down the list for other
Mm-hmm.
people who participated: Emerson Collective, Andreessen Horowitz, General Catalyst, Frisk Cressy, et cetera, et cetera, et cetera. It's like a who's who of healthcare investors. So cool. I mean, that's, I think what Devoted's doing is pretty neat. That 121% increase year over year was eye opening. Yeah.
It's a really big number in a Medicare Advantage market. We have just gotten done talking about all of the headwinds facing it. They must have confidence internally that this growth is good growth. For instance, I would be very curious to hear an interview with devoted leadership on how they feel about the advance notice details and what that implies for the business in 2027. Because you're right, it's a bit like Humana, where I mean, Humana, we have more public information on, so we can dissect that more and ask more questions of it. But when you are driving significant growth in this market, it seems like a real profitability challenge. Bob
Yeah.
Kocher, who's on the board of Devoted, was out in his annual predictions piece that came out in what, December, talking about how one of his predictions was Humana is going to crash, new leadership team is going to come in because it's not going to be able to handle this new membership because new membership is inherently less profitable than existing membership in the MA book of business. And like that's just kind of a truism of this market, right? Like so when they're increasing 121% across a whole bunch of new states in the last year of V28, I'm like, man, I that's just that does not seem like a recipe for profitability. And maybe this capital is enough to get them through it, and they feel good about that. And once they're through that, there's a better market. The numbers are certainly great, right? 98% of members in 4+ star plans, 6 contracts have 5 stars. Like that's really impressive news from the press release.
And we'll make 2027 easier, right?
For
Like
sure,
if even if
for sure.
the county level benchmark rates go up by, ending up being effectively 9 basis points, like you have the stars buffer for a bunch of
Yeah,
those new members. So that's nice.
totally. The one interesting, you mentioned the list of investors. Two interesting nuggets to me in that list. One, their lead investor, who apparently they talked about having long-term partnership with, is a group called the Space Between. Given the list of other names they have, the Space Between seems like an odd, like I don't know of another healthcare company they've invested in publicly. It doesn't ring a bell, commonly speaking. So it's interesting to see them leading the round. Good for them, for their involvement over a longer period here. two, seeing Morgan Health as one of the investors, I think is an interesting add to the list, given their focus on the commercial markets. I don't, I, you know, from reading the press release, I don't see that. But if you're running Devoted and you're looking at the Medicare Advantage market, it feels like you've got some levers to pull in terms of where you're going to find growth moving forward. And I don't know that all of them are going to be in Medicare Advantage, right? So I would be curious to see. It would be great if Devoto would go public so we can have earnings calls where analysts could ask them these questions because I think they'd be fascinating for the industry to hear, learn from, understand. Um, that being said, I understand why Devoted wants to be a private company in the current market, given that dynamic, right? It gives you more air cover to just do what you're doing. The fact that this came out on Friday, and I didn't even realize this till you said that on this call because nobody covered it, is kind of wild to me. You know, that's a lot of money they raise. It's a lot of membership growth. Zero discussion in any of the major outlets, and so it's kind of indicative of the benefit of being private at the moment.
Yeah. The last thing I'll say on this, so you covered United Health Group and Elevance, and they both showed that they were shedding pretty substantial number of MA lives going into this year. By my math, it was about 2 million between them.
Yeah, that seems right.
And on the other side of the ledger, so far, you've heard from Alignment Health, Clover, and now Devoted. Alignment's up 65,000 members. Clover's up 53,000 members. Devoted's up 255,000 members. That's CMS thought that this year was basically going to be flat in terms of MA enrollment. And so those other members had to go somewhere. Some of them might end up going back to original Medicare. That's hard. Generally, if you've been in MA for a while, it's hard to get Medigap. And so probably a lot of those people landed on other MA plans, and it really does feel like we're waiting for the other shoe to drop on the other roughly, what is it, like 80%.
I mean, like, kind of, right? Like, I think everybody is just waiting for Humana's earnings call, whatever that is, in a week and a half. Because I think the answer is gonna be there, right? Do the math on 2 million staying flat, lives lost. You got 250, 350K across those three plans, which are the three biggest growers. You're gonna have a lot of lives going into Humana. And it's going to be fascinating to see how they handle this in 2026, how they address the advance notice news that makes 2027 a hard year because um man, it's gonna be a ride for them to say the least.
They should sell tickets to this earnings call. That could be
I
a great revenue stream for them because yes, I just would
yes.
want like a reaction camera
Yeah.
for some of the
It
analyst
it
questions.
would be interesting to be a fly in the wall of their strategic planning sessions leading up to earnings and how they're going to tell the narrative. Because Q3 earnings call was all about how confident they are in their processes, how they could withstand this membership growth, how there's no bad growth if you price things right and understand that. And it's a reasonable narrative. They are going to put all of that to the test of 2026. Like it is going to
Yeah.
be a fascinating experience. And I think the house money is on them not being able to do this successfully because nobody's been able to do this successfully in the past, right? Like you are kind of defying laws of physics, at least they've existed for um, the past few years in the industry, and you're betting that you're going to be able to withstand this in a different way. I don't know. I don't
You
know.
have a bet with a community member on what the over under on the total number of lives Humana adds. I think that
I,
just doing the math here makes me take the
I,
over.
I think I've won that bet. Yes. I'm fairly confident in that, but you know,
All right. Well, that was great. Thank you so much for your time today, Kevin. We'll talk soon.
yep. See you,
Bye.
Martin.